Hello, Partnering for Vaccine Equity Learning community members, and welcome to this afternoon's learning event. I'm Bridget Courteau. Most of you know by now that I am the Director of Group Learning for the community, and on behalf of our team at the Urban Institute, thank you for joining us. About a month ago, we hosted an open forum with a vaccine researcher who answered your questions about the Delta variant, including how it differs from other strains of COVID, what it means in terms of risk, spread, and the importance of vaccinations. We asked an organization within the learning community, the Association of State and Territorial Health Officials, or ASTHO, if they'd be willing to partner with us to offer a second session on the Delta variant, but this time with a focus on how to communicate about it. ASTHO is the national nonprofit organization representing the public health agencies of the United States, the U.S. territories, and the District of Columbia, as well as the more than 100,000 public health professionals these agencies employ. We're fortunate to have ASTHO as part of the Partnering for Vaccine Equity Learning community, and are very grateful that two leaders in the organization have agreed to join us today to share not just their vast experiences with public messaging on Delta, but on the pandemic and vaccination more generally. Before we go further, I'm going to do our typical quick review of how the session will work. So you've all been muted upon entry to the session. There are a lot of us, so staying on mute unless you are speaking is key to keeping the discussion going without accidental interruptions. And you do have the opportunity to speak your question rather than type it into Q&A when we open up for questions and answers, which is typically about when we have about 15 minutes left for this learning session. So it's your choice. If you do want to speak your question, you can use the raise hand feature and we will unmute you. If you want to type your question, use the Q&A tab along the bottom to do this, and you can ask a question at any point during the learning session. The chat room feature is also open today. We encourage you to chat amongst yourselves as you'd like, but please use good chat room etiquette. And by that, I mean, don't post questions for the speaker in the chat because we might not see them there. And of course, please be civil to one another and to our speakers when chatting. Finally, as with all our learning events, we will post the slides and recording of this event on our community website and through the digest that go out through the CDC managed Adult Vax Program listserv, which hopefully all of you are part of. If you have technical difficulties at any point during the learning session, please send an email to our community manager's inbox. That's vaxequitylearning@urban.org. We'll be watching the inbox and we'll try to help you as quickly as we can. And now it's my pleasure to introduce our featured speakers today. Dr. Marcus Plescia is the Chief Medical Officer for ASTHO. He provides medical leadership and expertise across the agency, and he oversees its portfolio of chronic disease prevention and control programs. During the COVID-19 pandemic, he served as ASTHO's principal spokesperson and primary liaison to the Centers for Disease Control and Prevention. Dr. Plescia has served in public health leadership roles at the local, state, and federal level in North Carolina and at the CDC. In these roles, he's led successful efforts to enact systemic public health interventions, including expanded cancer screening coverage, prescription drug and disease reporting requirements, revised clinical guidelines, and state and local tobacco policy. He's been prominent in nationwide efforts to transform public health practice to a more population-based and strategic framework. Dr. Plescia received his medical degree, Master of Public Health, and Bachelor of Science from the University of North Carolina at Chapel Hill, and he trained in family medicine at Montefiore Medical Center in the Bronx. He's board certified in family medicine and has practiced in a variety of settings serving the homeless, urban poor, and rural underserved populations. And he's published extensively in the public health and family medicine literature. He's joined by Dr. Keith Coleman, who serves as the Director of Crisis Communications at ASTHO. In this role, Dr. Coleman provides crisis communication support and counsel to ASTHO members and health communicators. As a senior communications executive with over 20 years of experience building effective communications teams, Dr. Coleman has created innovative marketing and outreach campaigns, designed and implemented strategic plans, and increased public support and understanding of complex issues. Dr. Coleman has a proven track record of developing bold strategies to ensure traditional and digital assets are coordinated in efforts to raise visibility and reputation among all stakeholders. Dr. Coleman holds a bachelor's and a master's degree in communications and a doctorate in higher education leadership. He serves on the faculty at the University of Maryland Global Campus, Prince George's Community College, and Howard Community College. And additionally, he speaks as an invited guest lecturer for various higher education leadership programs on such topics as crisis communications, leadership development, higher education communications, and diversity, equity, and inclusion. Dr. Plescia, Dr. Coleman, thank you for spending time with us this afternoon. I'm now going to hand the mic over to you.
Great, thank you very much. It's a real pleasure to be able to join you today. And we hope we can have a good, robust discussion and leave you with some good tools to do the really important work that all of you are doing at the community level. So what we're going to focus on is this idea of how to communicate about COVID-19, and particularly about the COVID-19 Delta variant. And the way that we have formatted the presentation, I'm going to start off by going through kind of a formal presentation and some slides, just telling you a little bit about who we are at ASTHO and how you might work with us and with local public health departments going forward. And then I'll show you a few slides of some of the messaging and work that state public health departments have done to try to better inform the public about COVID and about the Delta variant. Then, in sort of a format to answer some of your questions, one of the things we want to encourage you as you communicate about COVID in your communities is to use the media, because that can be a very powerful way to get the message out. But many people are a little intimidated by that. So Keith Coleman and I are going to do a mock interview to just give you a little bit of a sense of, what does an interview look like? What kind of questions do you get asked? How do you answer them? And so we'll go through that, and you'll get some content from that too, because you can listen to how the questions get answered. And I think that'll help you with some of the questions you might have about COVID and the Delta variant. And then when we finish the interview, we'll do a quick wrap up, Keith and I just talking a little bit about why and how we answered some of the questions certain ways. Most of it will be pretty straightforward, but we put a couple of things in there to help kind of give you maybe some pointers. This is not a media training. Media training would be much more extensive, but the idea is just to give you a little familiarity and maybe some comfort with that kind of scenario. And then hopefully we'll get through both of those things with still a lot of time for you to ask questions, because we really want to spend some time hearing what you need to know most about. So let me start off with just a brief presentation about ASTHO and state public health departments, if I could have the next slide. So we are the Association of State and Territorial Health Officials, and so we represent the leadership of state public health departments. And we represent them by advocating for them with the federal government. We represent them by helping develop the leadership of the folks in those positions. And then we also provide technical assistance to states on a wide range of program issues that the CDC funds us to work on. Next slide, please. So this is a slide that captures a little bit who the leadership of state public health departments are. And you'll see from this that in 2/3 of cases, they're appointed by the governor. And so they have a lot of influence in state government. And that's the message we want to leave with you. These folks can help you if you're needing to get things accomplished at the state level, if you're looking at policy issues, if you need some input on something that is something that reaches populations across the state, our membership have a lot of influence. Also, you'll see from this slide, this says 64% hold a medical degree. Actually, right now it's about 75%. So these are the leaders of these public health departments are subject matter experts. They know a lot about medicine, they know a lot about public health, and they can potentially be very useful for you in that way as well. One thing that can be a little confusing depending on where you are is the state health department versus the local health department. In some states, it's all the same thing. The state runs the state health department, and they run and employ everybody who works in the local health departments. In other states, they're completely autonomous. And in some states, it's a little bit of hybrid of those two things. So many of you will probably find that you may be reaching out and dealing more with your local health department than your state health department. But just know that there is this overall entity that structures things, sometimes in a formal way, sometimes in an informal way. And we encourage you to work with them too. And you'll see some of the efforts that states have been making in the upcoming slides. Next slide, please. So we'll get into this further in this presentation, but I just wanted to say that, this has been a difficult time for all of us. It's been very difficult for public health to deal with this pandemic. There's been a lot of focus on all the things that have gone wrong, which there have been many of. But we did a little piece a few months back looking at some of the strengths. The public health departments have actually done an excellent job of handling many aspects of the pandemic. Public health departments were able to put into place some of the guidelines around mask ordinances and social distancing early on. That was very political. It was a bit of a struggle. But in the end, we actually did get the vast majority of the population covered by those regulations. State health departments have also been able to roll out what I think is a very, very impressive vaccination campaign now that we have a COVID-19 vaccination. And although we want to do better, let me just say now, it's rare we get this kind of participation in vaccination. And we'll talk about that some more too. But they've also been under an enormous amount of pressure, a lot of negative stuff coming aimed at them from people in the community and from policymakers, unfortunately. And that's something we'll talk about a little bit more as well. Next slide. So a little bit about how we're messaging about the Delta variant. You see from these slides from 3 different public health departments that the Delta variant of COVID is very, very serious, mostly because it is very, very infectious. The Delta variant is, as you'll see in the messaging from New Jersey, it's at least twice as contagious as COVID was before. So Delta is a mutation, is the result of a mutation that occurred with the COVID-19 virus, and it resulted in a form of the virus that's much more contagious and particularly dangerous to people who've not been vaccinated. And you'll see in these various charts on the slide some of the ways that states have been trying to message that out to the general public. Next slide, please. One of the things that we'll talk about a little bit more is the most important thing about COVID-19 and us getting to a better place with the pandemic, and particularly the most important thing about the Delta variant is that vaccines work, and vaccines protect people from getting sick, but most importantly, they protect people from getting severely ill, where they might end up in the hospital or even dying. And that's what these messages are about, different ways that states have tried to really push to make the case that we've really got to get everybody vaccinated now. If you have not been vaccinated, with the Delta variant on the scene now, if you have not been vaccinated, you will get the Delta virus. Next slide, please. And here's a little bit more of some messaging type approaches. You'll see there's been an attempt to reach people and influence people in any number of ways. The old-fashioned roll up your sleeves vaccine advocate that looks a little retro, I think, is a nice one. I like the idea. I live in North Carolina. I like the idea of bringing the summer back, giving people some more freedom if everybody would get vaccinated. And really making a point that these vaccines are safe and they're provided at no cost. And they will not just help end the pandemic, they will end the pandemic. Next slide, please. And this is just a little bit more, one of the things that we heard is that you were interested in ways to communicate about COVID-19 and the Delta variant. And here's a couple of other examples that you can see. And we'll make these slides available for people who are interested in being able to study on this a little bit. And next slide. And these are some of the approaches. Yeah, we put this slide in because, Keith Coleman and I are really pleased to have a chance to spend some time with you, as are the rest of our staff. I mean, we're getting to a place where it's this on-the-ground partnership, talking to communities that talking to people that trust you about the importance of COVID, about how dangerous the Delta variant is, and about how really safe and important it is to get vaccinated. So this is some of the efforts that have gone on in states. A lot of states are reaching out to the faith community. A lot of states are reaching out to local businesses, or in this case, Starbucks and Microsoft, big national businesses, but really going everywhere we can to get this message out. And that's what it's going to take to get us that step further with vaccination and get us through this pandemic. And the next slide. Okay, so we're going to segue in to mix things up a little bit. We thought we would bring Keith Coleman on to the video as well, and we'll just, as you heard from the intro, Mr. Coleman has a lot of experience in the journalism world, and he is going to do a little interview with me, and hopefully that'll give you a little bit of sense of the kinds of questions you might get, and I'll do my best to answer them. So, Keith.
So I couch this with a background in terms of the reporter. And one, we're from the Washington Communique, which is a national publication we produce on a daily basis. And we also have recently ventured out to do live podcasts. So the information we use during these interviews, we carry over to a podcast. I am a new reporter. I have been in the field for about 3 years. And so my experience is not as significant as it would be for a normal reporter. And so that's the backdrop. That is my lens. And so, Dr. Plescia, thank you for joining us. I would first like to open up with, we've heard a lot of mixed messages coming out of different agencies, and it's been very complex. And so our readers really want, in very simple terms, can you please explain what is COVID? What is the Delta variant, and why individuals should take this pandemic seriously?
Sure. So COVID-19 is a virus. It's a viral infection. Viruses are a common cause of infections and infectious diseases in our society. The common cold is a virus. The flu, influenza, is a virus. So these are common organisms that cause infectious diseases in human beings. Every virus, as it's out circulating, changes a little bit. Its genetic material changes a little bit. We call that viruses mutate. And most of the time when viruses mutate, it makes them less effective. It makes them less dangerous. But sometimes these mutations will actually end up in some changes in the virus that make it much more dangerous, more infectious, or perhaps even more deadly. And so that's what's happened with the COVID-19 Delta variant. The Delta variant is a mutation that occurred in the COVID-19 virus that ended up with this slightly different virus. It's still COVID-19, but it's just slightly different in the way it's made up. And those little bits of differences, for whatever reason, have made it far more contagious. So you are much, much more likely to get COVID if you're not vaccinated and you're not being careful than you would have been 6 months ago when we had the original COVID-19 strain. So it's very, very infectious, and that's why we have to take it very, very seriously.
So I've heard so many different comments about who is most at risk. Perhaps you can share with our readers individuals who are more at risk by this outbreak, by this pandemic than others.
So let's be clear. If you have not been vaccinated, you are highly at risk. We'll even go so far to say that if you have not been vaccinated with this new Delta variant, you will get COVID. It is so infectious. It takes so little interaction with other people now to get it, that if you've not been vaccinated, the chances are very, very high that you'll get COVID. Now, we're still particularly concerned about certain groups of people. People who are older don't do well when they get COVID. That's where we're seeing most of the hospitalizations and deaths. So if you're older than 65 or 70, you're much more at risk. If you're older than 65 or 70 and you have not been vaccinated, you are at very high risk that you could get this virus and you could get very, very ill. If you have underlying medical conditions, even the medical condition of being overweight is a risk for COVID. So any number of medical conditions puts you at higher risk as well. And if you live in a group environment like a nursing home, or people who are in incarcerated in prisons. Those people are at much, much greater risk as well because they're in close contact with each other.
So I have not received the vaccine and I haven't been vaccinated. And my cousin who lives with me, he also is not vaccinated. We're both hesitant because of the different things we've heard. What would you say to those who are hesitant about the vaccine and the importance of getting vaccinated?
Well, first of all, it's natural to be a little hesitant about something new like this. And so we like to reassure people this is a very, very safe vaccine. You know, we are one of the most advanced societies in the world. We have some of the best scientists in the world. We have a process that is airtight to evaluate any vaccine or any medication for that matter before it comes out and it's available for the public. So this vaccine has been carefully tested and we have great confidence that it is safe. It's also extraordinarily effective. I don't know really of any other vaccine that's quite as effective as some of these vaccines we have for COVID. When we talk about 90% effectiveness, I mean, keep in mind that the flu shot, which is excellent, which makes a huge difference, the flu shot is actually generally only about 50 or 60% effective. So this is such a wonder of science, this vaccine, and I just want to, because I'm so enthusiastic about it, I just want to encourage everybody to take advantage of this. This is our way out of the pandemic. This is the way to get beyond all of this that we've been dealing in the last year and a half. And it's also important for individuals. I mean, if you don't get vaccinated, this is a much more infectious strain and you are very likely to get sick and you could get quite ill and end up in the hospital and having a very bad outcome. So, you know, if you have concerns, talk to somebody you trust who has some expertise. Ideally, if you have a doctor or a healthcare provider, talk to that person. But you need to talk it through and try to make a decision based on the safety and effectiveness of the vaccine.
Perhaps you can clear up or clarify one thing for our readers um, around behavior factors. Are behavior factors placing persons at greater risk? And if so, what are they? And can you recommend some actions that individuals can take to confront these behavior factors?
So the most important behavior is to get vaccinated. I mean, that then puts you in a very safe category, and you know the risk that you could become severely ill becomes minuscule. Some people can't get vaccinated. Children under the age of 15 right now can't get vaccinated. So there's other behavioral factors that we're using in those settings still. Keeping a social distance, trying to keep 6 feet between you and anybody you're interacting with, particularly if you're unvaccinated or you're under the age of 15. Is very important. Wearing masks is very, very effective to prevent transmission of the virus. And then the third tool that we have in the toolbox for COVID is testing. We now have a wide variety of different tests out there, some of which you can take the test at home in the privacy of your home and get your results in 15, 20 minutes. Now, testing is important because you have to act on the results of the test. If you test positive, that means you're sick. That means you could give this infection to somebody else. And in that case, we ask people to isolate, stay at home for 14 days to make sure until you get through the infection to make sure that you don't inadvertently infect somebody else. So those are some of the core behavioral factors that we can pay attention to really get this virus under control.
Is the problem, in your view, people not taking responsibilities for their own actions by not getting vaccinated, or are they not following social distancing practices like wearing a mask? What do you see as the core problem?
Yeah, we need people to do the right thing, and these various behaviors are the things that help us as a society get through this pandemic. But I think we all need to remember to be human and have patience and have compassion for others. There's a lot of reasons why people aren't getting vaccinated, or why they're not wearing masks, or why they're not testing when they're sick, or why they're going to work when they know that they're sick. There are a lot of reasons for that. And, you know, one of the things I'd like to point out is the groups that we see that are actually at the greatest risk, it's not about personal responsibility. It's about the situation people are in. The people that are high at risk, and when you look at the states that we're seeing the greatest rates of infection right now, these are states where the poverty rate is much, much higher, where the rate of education is much, much lower. These are states where the states themselves are, some of the states with the least amount of resources. So, that's really the most important backdrop. These are folks, most of the folks who are getting sick now are folks that are facing a lot of adversity in addition to this pandemic. And I think we need to be patient with them, and we need to find ways to just talk them around to doing the right thing. You're on mute.
With that, and another question that I think comes to mind is, what can we do to reach those hard to reach communities that you just mentioned? Are there specific community leaders or organizations that we can reach out to help us with those hard to reach populations?
Yeah, increasingly, I think we're finding that with this, particularly around COVID vaccination, we're to a group now who are hesitant to get vaccinated for a variety of reasons. And we, state and local health departments, are starting to reach out to folks that we know there might be some trust with amongst those individuals. One group that's often very trusted is medical care providers. People tend to trust their doctor. They go there for medical advice. They believe their doctor, and they take their doctor's advice seriously. So we're working very, very closely with the provider community to help them know how to communicate and talk about this issue. But also working with groups that have outreach and trust in the communities that they live and work in. One of the best examples of that is the faith community. Many people trust their pastor, their minister. And so those are important and powerful folks whose opinions about COVID and COVID vaccination make a big difference. And so we're trying to work with those kinds of trusted opinion leaders as well.
So what we've heard from our readers is that there's a lot of frustration, and you can see it in the comments after each of our articles. So who's to blame for this in terms of frustration, in terms of hesitancy? Why is and this is, I'm going to personalize it, why is my health department not doing more to make people get vaccinated? It seems like people are not doing their jobs here. What is it that we can do to hold them accountable?
Well, I think it's really important to step back and realize what a difficult, unprecedented time this has been for all of us, and the adversity that we've all faced with this pandemic.
Yeah, but who's to blame? Who's to blame here?
There's nobody to blame here. This is something that happened in our society. This is an infection that kind of came out of the blue, that was able to blow through many of the normal things that we have in place to control and keep an infection like this from spiraling out of control. It was a relatively unknown organism. There were just a lot of things about this that nobody knew about and nobody was expecting. And actually, I don't know that there's really a lot of room for blame. I think a lot of people who've been taking the lead in this response have been very effective. We have vaccination rates amongst adults that are approaching 70%. I don't know any vaccine that has 70% participation. So we're actually making a big difference. And, getting this last 20 to 30% of people vaccinated is going to be hard. I mean, we're all human. But I think our systems have served us well. And I think it's easy when you're frustrated and it's difficult to start feeling that it's somebody's fault. But actually, I think we need to take a step back and not just our professionals, but each other. We've gone through a lot to get this thing under control. We've stayed at home. We've worn masks. We've not seen loved ones. We've done what it takes to take on this virus, and we will get through it. But I think we just need to be patient and get through this last little bit.
Well, I appreciate you taking time. I know you're on a tight schedule, but one final thought, anything you want our readers to know as we close out this interview?
It's very important for everybody to realize that there is a light at the end of the tunnel. We are getting to a place where we will get through this pandemic, but we are having a difficult time because of this new Delta variant. We must take it seriously. We now have the tool at our fingers that we need have to be able to win, and that's the vaccine. And so I really encourage everybody to get vaccinated yourself. And if you have been and you have friends or family who haven't, really work with them to try to get them to make the right decision.
I appreciate it. I'm actually going to go get vaccinated after this call. Thank you.
That's good to hear.
All right, that ends it.
Okay, so Keith Coleman and I are going to do a little bit of just review of what we were up to with that, and then we'll open it up for you. I'll just say, I had a few key points I was trying to make. Hopefully you picked up on them. This is serious. The solution is to get vaccinated. There's not really a lot of benefit to placing blame, and it's probably not very productive. Those were some of the key things. We purposely built this towards the end there. Keith got a little bit confrontational or pushy with some of his questions. That's unlikely to happen to you all, but reporters tend to be pretty nice with the general public, and they're usually pretty nice to me. But they do like to go after public officials, and Keith asked a question about that because we want you to be aware of that. I mean, that's not very useful right now. I think that most of our leadership is doing the best that they can, and that's sort of one of the things just to be on the lookout for. But Keith's the expert on this, so why don't you give a critique, Keith?
Yeah. So the thing I would say, and this is something that we've talked to others about in terms of being a public information officer or a health communicator or even a show. But it's something I think is applicable here, is to apply the KISS principle, which is keep it very simple, right? That's exactly what we want you to do. We also want you to listen for the substance of the question, right? Not necessarily the colorfulness of it, but really what is the substance? What's the gist of the question? And then answer that first. And then you can then tackle the other colorful pieces, perhaps secondary. But really keep it simple, listen for the substance. And then the last thing I would say, do not become defensive. Because when you become defensive, it changes and shifts the tone of the interview. And that will then prompt a reporter to become even more confrontational, which is something you don't want, especially on a topic where, we're all trying to do our best to really help save lives here. And so it's not something I created, it's not something that the Plescia created, it's really something that we're all just trying to navigate. And so we don't want to become defensive. So those are the three things. Keep it simple, address the substance of the question, do not become defensive. And Dr. Plescia, I see we have some comments here in the chat session. I don't know if you want to address those now or how you want to handle those. But I can read those to you if you want.
Yeah, I can see them. Yeah, we will make the slides, and we can make a transcript available if this was recorded. We're happy to share anything that we've gone through.
Perhaps there's one question that keeps coming up. How can we address hesitancy of getting the COVID vaccine in addition to getting the flu vaccine? It's flu season now. That's a question we've gotten before. So as a physician, I think you're the perfect person to tell it.
Yeah, I mean, you really want to get them both. And I think the most compelling argument that I've heard for that is, if you get sick right now with a systemic illness, you have no idea. Is it COVID? Is it the flu? So just hedge your bets and get the vaccine for both, and you'll know that whatever you might have, you're going to be okay. This is a good opportunity to really point the focus on what a significant infection influenza is, the flu. I mean, the flu kills people too, and the flu can make people very, very ill. And we certainly want to just get through this next fall and winter without any of that. And there are going to be some combined vaccines coming out where you can get 2 in 1. I'm not sure if those are available quite yet, but you can also, it used to be you had to have a period of time between getting one vaccine and the other. That is no longer necessary. So, you can make it convenient. Bridget, shall we open it up to you for questions from the audience?
Sure. So we have 10, 15 minutes left for questions. So please, folks, put those into the Q&A, and we'll also go quickly to the attendee list and make sure that no one has their hand raised. I don't see any hands raised, but that's also an option too. We actually did ask for this registration for this event. We had a field to see if anyone had any questions. So there were a few that came in that way too. So I'm going to ask you one of those. Many of these were actually covered by your mock interview, which was great. I really liked that format. But there's a question about third dose versus booster shot messaging. So I know we didn't really touch too much on boosters, but in terms of speaking about the boosters, if you all have messages that you are kind of starting to use or figured out the best way to kind of address the need for additional shots after you get your first dose or doses.
Yeah, well, I'm looking at some of the questions that are popping up on the Q&A. So let me just run through a few of those. There's a question about COVID-19 FAQs being in only one language, and I was not aware of that. Usually the government is good about at least translating into Spanish and often into other languages as well. And if they don't, states are usually pretty attentive to that. So I guess we'll have to look into that. But I would think, particularly because the vaccine's been out for a while, that would have been developed now. So we'll have a look and maybe help you look a little more closely. I feel certain that there are some resources out there for that. Why are we using the rate of one dose among adults as a vaccinated rate instead of fully vaccinated rate amongst the population? Well, I think we're using the one dose as adults is the idea that once people have gotten one dose, there's a pretty good chance they'll get the second. So, the idea is we're getting there. That's definitely, we use that because it's the most positive. And sometimes we all need a little positive news. I think the issue, though, of percent of the population vaccinated, that's a little misleading because kids under the age of 15 can't be vaccinated right now. So there's a proportion of, you can't get to 100% right now because it's not available. So what we tend to do is talk about the percent of those who are eligible to get vaccinated. And I think that's probably the best. I mean, that's the ultimate progress. That's the thing that's most important. Is the booster and the third dose the same thing? Yes, it is. The booster may be a little lower concentration of the vaccine than the original first two of the series, but it is essentially the same vaccine that you received when you got dose 1 and 2 if you had Pfizer and Moderna. And that's important because some people think that the booster is maybe somehow specially made for the Delta variant, and that's not the case. This is the vaccine we've had all along. It may be that in the future we'll have a slightly different form of the vaccine that is made differently so that it's even more effective against some of these new variants. But right now we're working with the same vaccine that we've had, and we found that getting a third dose does bump up your immunity and your protection a little bit more, and particularly in people who are older and in high-risk settings, that may be a particularly important group to consider getting a third dose or a booster. How would you address mistrust of government, including COVID statistics? I think that's a challenging question. I mean, some people, they don't trust the government, and some people have good reason to not trust the government. In many situations, we suggest people talk to somebody else they do trust. Most people do trust their medical provider. So, if you're having concerns and if you're a little distrustful of the vaccine, which you see as a government program, talk to your medical provider or talk to other people in your community who are knowledgeable and can maybe help you work through that. But I don't know, Keith, if you have any other thoughts about how to handle mistrust of the government.
Yeah, I think trusted organizations must forge a pathway forward in terms of regaining trust and rebuilding trust, not only in public health, but in everything that we do. We need to reevaluate and really continue to regain the trust of the public. It just didn't impact local health departments. This misinformation is impacting all of us, and it is our responsibility to get it right and to really share factual information and not just misinformation and disinformation. So I appreciate the question. And I guess the reality is that organizations must take a deep look in the sense of what worked, what didn't work, and how do we improve our messaging, and how do we get out messaging in an age of social media and in an age of instant gratification where people want information at the finger of their at their fingertips. So thank you for the question. Appreciate it.
Yeah, a couple questions about here about people who've already been infected and had COVID-19 infection, and who may feel that they're protected by their natural infection or natural immunity. So the response to that is that unfortunately, people who've had COVID-19 often don't have that strong of immunity, and they don't have the same level of protection about being protected from a repeat infection of COVID-19 as people who get the vaccine. And I don't know that we really understand why that's the case. Oftentimes having a natural infection does confer immunity in the same way a vaccine would, but we're seeing a lot of data to show that that's just not the case. So just because you've had COVID doesn't mean you couldn't very easily get it again, and you couldn't become acutely ill with it as well. Until we learn more about that, the one thing we do know is that if you've had COVID and then you go and get vaccinated, you are really very, very well protected then. And that's what we're recommending for everybody. How long is the booster good for? I think we're still learning how long the booster is good for. There's this question, we're gonna have to keep getting boosters. We probably, I suspect that COVID-19 may become very similar to the flu. Every year you have to get a new flu shot because the strains of flu change a little bit. And I suspect that we'll find with COVID, once we get it under control, it's still not going to go away. It's still going to be out circulating in our world and our community. And barring anything unforeseen, we're probably just going to have to deal with it, but we will have the tools to do so, and we'll be able to do so in such a way that it doesn't cause the level of suffering. But that will probably require people to get revaccinated on a regular basis. And I don't know that we know right now how often that will be. The boosters right now are being offered to people sort of 6 to 8 months out. It's not clear. It could be that we could wait a little bit longer than that, but we'll just have to see what we learn as we get more information, which we are getting every day. That's another positive thing about the COVID-19 pandemic is the longer it goes on, the more we learn and the better equipped we've been to be able to fight it. Vaccinated with J&J and are not happy with the protection they are receiving and might be seeking to get Pfizer or Moderna. Well, my hope is that we will get a Johnson & Johnson booster dose approved soon, because the data that I've seen so far show that if you've had one Johnson & Johnson, and granted, if you've had a Johnson & Johnson, the effectiveness of that vaccine is a little lower than the Pfizer or the Moderna vaccine. But the data I've seen, which I hope will hold up, is that if you have a second dose of the Johnson & Johnson vaccine, the effectiveness jumps up into the 90% range. So at that point, it's just as effective with a booster as Moderna and Pfizer are. And you get the added advantage that you only had to have 2 shots, not 3, which is now the recommendation from Moderna and Pfizer. So I would say the government is not, the FDA is not approving mixing and matching vaccines. So if you had the Pfizer and you want a booster, you've got to get a Pfizer booster. If you have Moderna, you've got to wait, which I think is going to be pretty soon. There'll be a booster for Moderna. And hopefully Johnson & Johnson is not too far behind that. And it could be that as we learn more, we'll realize that you can mix and match. And if you've had J&J, you could go ahead and get Pfizer or Moderna. But I wouldn't lose confidence in Johnson & Johnson yet. I think we're going to find that with the booster, it is actually going to become very similar in its performance to the other two. How do you address concerns surrounding Johnson & Johnson, especially after the report of blood clots? Safety has been our #1 consideration with the vaccine, and every single thing that's popped up as a potential danger or side effect or risk has been explored very carefully, and that's what we saw happen with Johnson & Johnson with the blood clot issue. And people will remember that we actually had it pulled from the market for a period of time until we could sort that out. There is some very small risk of blood clots in people who receive the Johnson & Johnson vaccine, but the risk is far lower than the risk of getting COVID and having a serious infection of COVID. So it's one of these things that I don't mean to be callous, but there's risk in everything we do in our world, and the risks that we're seeing with these vaccines are extremely rare occurrences, and so for most people, when you really look at it and understand it, the benefit just far out exceeds any of these potential risks that might occur.
Thank you so much, Dr. Plescia, Dr. Coleman. We really appreciate you joining us today. We are coming to the end of our learning session. We do have a satisfaction poll that we our standard poll that we do at the end of each event. It will only take 1 minute of your time or less. So learning community members, if you wouldn't mind, while we wrap up, just taking a second and completing this poll. Just to reiterate, I know Dr. Plescia, you also said this, but all of our materials from these events are saved to our website, and we also send them around through the community listserv. And ASTHO, I know, has a very broad website with lots of materials too. So check out ASTHO's website. We will make the transcript available. We specifically were asked about the transcript for this. We don't do that for all of our events, but I know some of you would really like to see the actual written version of those great answers that Dr. Plescia was giving during the mock interview. So we'll make sure to have not only the video recording for this, but also the slides and the transcript if you want to see those answers written out. And I think that is all from us. So Dr. Plescia, Dr. Coleman, and all of the ASTHO team who helped plan this event, thank you very much. And we are very happy to have you be part of our learning community, and hopefully we'll hear from you again at another learning session in the future.
Thanks. Thank you all for
Thank
your
you.
work. Yeah.
Thank you.